I've helped hundreds of people relieve peripheral neuropathy pain with targeted exercise routines, and in this video, I'm going to walk you through 6 exercises that can dramatically reduce your foot pain in just a few minutes a day. This is the exact 3-phase system I use, starting with seated aerobic exercises, then strength training, and finishing with balance work. By the end of this video, you'll be equipped to get relief fast and improve your mobility, all from the comfort of your home. Let's dive right in. Phase 1 is seated aerobic exercises. I will demonstrate 2 exercises. Seated aerobic exercises boost circulation, helping deliver oxygen and nutrients to those damaged nerves, which can reduce pain, numbness, and tingling. They provide a low-impact way to stay active without putting pressure on sensitive feet, promoting better nerve function and overall mobility. Seated aerobic exercise number 1 is called seated kicks. To begin this exercise, lift your knee straight up in the air slightly, pulling your foot off the ground. Then straighten your knee by kicking your foot out away from you. Bring the foot back down, then finally lower your foot to the floor. You may feel a bit in your hip flexors from lifting and holding your leg, as well as in the quadriceps, the front part of your thighs, when kicking the foot out. Shoot for 2 sets of 10 repetitions on each leg, and do this a couple of times per day. This exercise will help increase blood flow into the legs and feet to nourish those nerves that are starving. Seated aerobic exercise number 2 is called seated leg marching. To begin this exercise, lift your knee straight up in the air as high as you can, without losing your posture. Then lower your foot back to the ground and begin lifting the opposite one. It should look like a marching motion going back and forth. Once again, you may feel a little bit in your hip flexors from lifting your knees toward the ceiling. You're going to shoot for 2 sets of 10 repetitions on each leg, and do this 2 times per day. This exercise will help increase blood flow into the legs and feet, nourishing those nerves that are starving, and working your core a bit for stronger stability. Next is phase 2, strength training. Strength training is crucial for patients with peripheral neuropathy in the feet because it helps rebuild muscle mass and strength that may be lost due to inactivity or nerve damage. As nerves in the feet deteriorate, muscles can weaken, leading to issues with balance, stability, and mobility. Strength training targets these weakened muscles, improving their endurance and function, which can help reduce the risk of falls and injuries. The first one is called calf raises. To begin this exercise, stand with your feet about shoulder width apart. You may want to be near a door jamb or something to hold on to. Begin by pressing the ball of your foot into the floor, lifting your heels off as far as you can. Pause at the top, then lower your heels slowly back down to the floor. You will feel this in the calf muscles, the back side of the lower legs. Shoot for 2 sets of 10 repetitions and do this 2 times per day. This exercise will help increase blood flow into the legs and feet to nourish those nerves, as well as also help with strength and balance. You can build up to doing this on 1 foot at a time to make it even more challenging. The second strength exercise is squats. To begin, stand with your feet about shoulder width apart. You're going to drop your hips backward in a hip hinge type motion like you're going to sit into a chair. Continue to lower your buttock towards the floor while keeping your knees from going too far in front of your feet. Try and keep your back nice and straight while doing this. You're going to go down as far as you can, but use caution so that you don't fall and get hurt. Once you feel that tension in the back of the legs and the buttock, you're going to stand back up by squeezing your thighs and your rear. Shoot for 2 sets of 10 repetitions, and do this 2 times per day. This exercise will help increase blood flow into the legs and feet, nourishing those nerves that are starving. It's also going to help strengthen the core and the glute muscles that are key to our ability to walk. Phase 3 is balance training. Balance exercises are crucial for people with peripheral neuropathy because nerve damage affects coordination, making it harder to stay stable on our feet. By improving balance, these exercises help patients feel more confident and stay on their feet, reducing the risk of falls and preventing injuries. The first balance training exercise is single leg stance. To begin this exercise, stand with your feet about shoulder width apart. You may want to be near a door jamb or something to hold on to. You're going to begin by pulling 1 foot off the floor behind you towards your glutes. Hold this position for about 30 to 60 seconds. You will then lower that foot to the floor and switch sides, lifting your other leg. Feel free to hold on to something as you begin doing these exercises. As you get more stable, you can try holding on less and less. You may feel this in your leg muscles on the side that your foot is on the floor, as those muscles are working hard to help keep you upright. Once again, we're going to shoot for a couple of sets of about 30 to 60 seconds on each foot, and do this a couple of times per day. This exercise will increase blood flow into the legs and feet, nourishing those nerves, and is also going to help improve balance and coordination. The second balance exercise we're going to work on is heel-toe walking or tandem walking. To begin this exercise, stand near a wall that you can hold on to if needed. You'll start by placing one foot in front of the other. Placing your foot directly in front of the other so that your toes of the one foot touch the heel of the other foot. Think of the officer test where you have to walk a straight line. Then lift the backside foot and place it in front of the other, placing that heel next to the toes of the other foot. Continue this pattern, one in front of the other, down your hallway, shooting for about 10 to 15 steps. Do this a couple of times per day. This exercise again will help with balance and coordination. You now have a simple, easy to follow exercise program for peripheral neuropathy in the feet, designed to improve aerobic endurance, build muscular strength in the legs and feet, and enhance your balance. Come back to this video again and again to follow along. Peripheral neuropathy takes time to heal, and sticking with an exercise program like this at home for the next 2 months can make all the difference in your recovery. If you found these exercises useful and got value from this video, please like and share it. Leave a comment below and tell me which exercise gave you the most relief or the biggest results. Was it the calf raises or was it the single leg stance? And don't forget to subscribe for more effective strategies to boost blood flow and reduce neuropathy pain in your hands and arms. The next video you should watch is this one, where I guide you through 5 exercises to improve blood flow in your legs, feet, and hands for even greater relief. Go watch this video next.